Today's medical moment, we are talking about lung cancer, something that touches hundreds of thousands of families in the U.S. every year.
Joining us today is Dr. Pranitha Produtavar, also known as Dr. Pro, an oncologist at USA Health Mitchell Cancer Institute. Doctor, thanks for being with us. And we all know about smoking, of course, but what are the other risk factors for lung cancer?
I am going to say cigarette smoking, cigarette smoking, cigarette smoking. That's the most important risk factor for lung cancer. We have small cell and the non-small cell. Small cell almost always exclusively develops in people who smoke cigarettes. So if you don't smoke cigarettes, your risk of developing small cell lung cancer is less than 1%. In the non-small cell, you do have some other environmental risk factors, especially if you have some asbestos exposure, you can develop mesothelioma, which is kind of a lung cancer. Occupational exposure, you have some genetic risk factors and environmental factors. Sometimes we don't know that people develop cancer in the younger patients, but I would say if you wanted to decrease the risk of developing lung cancer, cigarette smoking, cigarette smoking, cigarette smoking. That's the number one main cause, that's the number two main cause, and that's the number three main cause of lung cancer.
Dr. Pro, you're talking about cigarette smoking. What about vaping? How does that contribute to lung cancer?
That's a very, very good question, but we do not have the data whether vaping is a risk to cause lung cancer. Is it one of the risk factors? We do not have the data yet, but we do have the data. Vaping can actually cause acute lung injury that requires hospitalization in the treatment. But as of now, because the vaping is relatively new, probably people started using this in the past 10 years. But if I have to tell you, we do not have the data about whether vaping is a risk factor for lung cancer, but we do have the data about vaping causing significant lung injury. Only the time will tell us, actually.
All right, Dr. Pro, thank you so much for joining us tonight.
All right, my pleasure.